Have you ever had these annoying pimples that won't go away? Well, you are not alone. In fact, around 90% of the population suffer from acne or pimples. So, there is nothing to feel insecure about it. But, can a cancerous mole look like a pimple? Should you be concerned? And what are the warning signs to look for to seek medical help immediately? Let's check it out. Basal cell carcinoma, or BCC, is a type of skin cancer that can show up on the skin in many ways. The problem is, it can be mistaken to a pimple, or a scar, or even a minor skin injury. To identify this, let's go to the first warning sign. If you see a pink or reddish growth that spreads around the skin spot, there is something not normal and should be checked with a doctor immediately. These signs could be easily mistaken as a minor skin injury or an acne scar. Let's take another example. Here, you can see the pinkish spread all around the skin spot. This sign is ignored, therefore increasing the risk of cancer growth and delay in treatment. The second warning signs you need to look for is a growth or a dark scaly patch of skin on or near the ear. BCC is found near the ear and could be mistaken for a minor skin injury. It can either be dark or light, but looks like an extra skin spot that can be easily mistaken to something less harmless. Let's look at another representation. Here is a growth that looks not as dark as the first image, but definitely looks spreaded around the area. Alright, let's go to the third warning sign. This is a sore that doesn't heal. Even if it looks like it disappeared, it returns back and stays for a long time. It oozes out blood and infectious pus resembling a pimple. The only difference is that a pimple disappears, but this growth doesn't. It can also turn out to be harmful, unlike a pimple. This can be deadly, since pimples are the most common forms of skin disorders. So, if you find a pimple that doesn't heal and stays for days, becoming worse than before, check with a dermatologist to be on the safe side. This also has a very similar resemblance with common skin problems. It is a scaly, slightly raised patch of irritated skin that has this reddish color to it. It can also be pink and light blue in color with small light patches. Here is another example. You can clearly see the irritated mark in the center of the affected area. Basal cell carcinoma is no joke. The fifth warning sign is a round growth that may be pink, red, brown, black, tan, or the same color as your skin. This can be mistaken for a mole or a wart. Due to its normalcy in appearance, it can definitely be ignored. The best way to identify this is to check for any extra skin spots that never occurred before in a specific location. If you feel like there is an irregular skin spot that came out of nowhere, ask your dermatologist about it. Now, you may ask me, hey, I get it that the basal cell carcinoma is this silent danger, but how do we actually identify it? Well, that's why we created an application DermaChecker that checks the skin spot, and based on the danger levels, it provides an assessment whether the image is at risk or normal levels. But regardless, keep the signs in mind and visit the dermatologist at the earliest. Now, let's go over the sixth warning sign. This is a growth-like mole that is slightly scaly and is mostly present in the nose. Since it resembles an age spot or a freckle, patients usually ignore it, leaving the growth to become more dangerous to handle. It is always said that, once you see an age spot, the better option is to have a dermatologist examine your skin before you treat that spot. You can visually see how the spot is mildly colored with a light haze of pink, giving it the resemblance of an age spot. Last, but not least, a scar-like mark on your skin that may be white, yellow, or skin-colored and waxy. The affected skin may look shiny and the surrounding skin often feels tight. The tightness in the surrounding areas usually looks like a harmless scar. When seen on an elderly woman, BCC can be easily mistaken as a scar and would be left untreated. Although, these type of cancerous growths may not enlarge more than the tumor site, if left untreated, basal cell carcinoma can spread to the muscles, nerves, bones, brain, and in rare cases, cause death. It is understandable that even though these moles are intimidating by resembling basic skin problems, early detection is usually done and the mole is removed on time without further damage. Look out for any new, changing or unusual skin growths, so you can spot skin cancers like BCC when they are easiest to treat and cure. Take care and stay safe. And don't forget, test your skin today with Derma Checker and visit a dermatologist immediately.